And again, just to give some context, Dimitri, for those that may not remember or were here when you presented in the past, that you, a federal employee, and you were uh, challenged for revealing some data that went against the narrative. Have I got that correct?
That's right. So there is a website which is IVIM.ca /hearing, and it tells you all the details. Dmitry Gorodnichy versus Canada Border Services Agency. And for the first time, actually, I put the agency name on my website. I never mentioned ever that I was with the CBSA for reasons that I do not want to compromise my colleagues and just create any other issues. But the abstract is right here. So this hearing concerns a challenge of a 5-day suspension, one in a series of escalating disciplinary measures imposed on myself in the last 4 years for publicly visualizing and analyzing official Government of Canada COVID-19 vaccine-related data. So something in that data was not looking maybe good, or for whatever reason, employer thought it's not good to show this data to the public. Employer states that I made my own opinions, that I'm not the expert in epidemiology, and I state I make no opinions. I just develop web applications which allow Canadians to see the data for themselves, and you will make you will make your conclusions yourself based on the numbers which I will show you. That's as simple as it is. I'm the expert in data science, in data visualization, and I can build visualizations which are not available elsewhere for whatever reasons. All these numbers are publicly available, but you will not be able to find them or easily extract them and compare one to another, because you do want to compare, for example, the number of people who died of COVID vaccinated versus unvaccinated, don't you? Right? So everyone would like to see the evidence that vaccinated people die in much less rates compared to unvaccinated. That's the first question which we all wanted to see once the public data has become available. And it has become available in September, October 2021, just before mandates were announced. So I will use this opportunity to provide a quick overview of my website for people who are interested to dig deeper. But again, it starts from the fact that my hearing has become public. For 4 years, it has been hidden. It was not public. I have removed many of my articles. Many of my YouTube recordings were removed as per instructions of my employer. But now all of them are public. And all of this evidence is public. So why not to take advantage of that? And I will guide you through where you can find some of this evidence. And I will show you just one piece of evidence today. So the way I tried to organize this website, I have now my hearing, and in here you will have subsections. Employer's book of documents, everything employer has against me, including all the evidence they use against me, and then my own Griever book of documents, which I will open today for you. And then I have also raised concerns here. In fact, they were explicitly written in my communications to my employer. I have these red flags, which I see myself from the data. Can you help me to address those red flags? So I put all this information here on the website, but let me just recap what has happened so far. So the significance, of course, is right there. We are defining the country for our generations, whether it's a country where the evidence will be driven by political narratives, or the country where political narratives are driven by the evidence, because indeed, that's the most important. We have the evidence, but let's make use of it. There is a short documentary which now has been featured by Rebel News, I believe, which was made 4 years ago, which provides a 4-minute summary of my case in entertaining manner with music. And the updates are the following: that the hearing has been adjourned until summer. So what we have so far, the employer has presented their allegation on the first day. The employer witnesses testified, both of them, who are my immediate directors, so my immediate managers, directors, 2 of them have testified, and I had a chance to interrogate them. Cross-interrogation, which was Very nice, actually, very nice. Both of them confirmed that I am expert in data engineering, in data visualization, that I am expert in evaluation of systems, in particular biometric systems, and they have trusted my advice for 15 years related to evaluation of biometric systems. I was saying this system is good, this system is not good, this system performance changes over time, it goes for worse. They trusted my visualizations and my advice up till that point. And at this point, when I showed some results related to the performance of vaccines, instead of listening to my advice, they told me it's better not to talk about it because you may create hesitancy. Just follow the established processes to raise your concerns. And in fact, they have not even identified what are those processes, and they were not very clear in what were those instructions to avoid discussion. I'm just showing the data, which I think everyone will benefit from. So 3 days have passed, and in fact, these were very good 3 days, I think, for the history of Canada, because they have testified, I have a chance to cross-examine them, they confirmed everything I wanted them to confirm, and 2 more things they have confirmed: that my postings have not affected the performance of Canada Border Services Agency. In fact, it has nothing to do with the mandate of Border Agency, which is very important. And also, my performance didn't suffer. I have a 5-star performance for many years in the agency. So again, it has nothing to do with the agency mandate or my performance. And in fact, when I asked my second director, do you think it could happen in any other agency, fisheries, forestries, whoever, any data scientist in any Canadian agency would build application to visualize data, do you think he would also be suspended? And he said, yes, it has nothing to do with CBSA, it has nothing to do with you, it has to do with duty of loyalty to your employer. And employer is government of Canada, regardless of whether you work for fisheries, parks, food inspection, and so on. So that's how they frame it. And we live in a democratic country, and we have lots of case law, which actually tells me that no, there are exemptions from the duty of loyalty, in particular when it relates to health and security of public. So I will be using that when the hearing will be resumed. And this is why the evidence becomes important. Now, the hearing has been adjourned on Friday, and specifically on the 3rd day, I need to read here this application, this paragraph here. So on the 3rd day, the griever called his first witness, professor and data engineer from the University of Waterloo with PhD in medical system devices performance. And I called him as my first witness. And I asked him to testify on the challenges of finding the desired information from official PHAC reports. Because remember, all the data is published. It's publicly available. And I asked him, as specialist in data analysis, was it easy for you to find this information? And he said, no, it was extremely difficult to find this information. But yes, eventually I was able to find it. But what you've built with your applications make it so much easier for everyone to see what Public Health Agency of Canada has actually published. So, however, following the discussion with the chair, who pointed out that the griever's data is, is not put in doubt, quote unquote. Your data is not put in doubt. It is, so the grievers, it is what the griever did with this data that is questioned. And this is a very powerful statement from the chair, because all my witnesses were invited to testify that every graph, every number is obtained directly from the source. They came to testify that all my numbers, curves, graphs, everything is correct to the best possible professional level. So at this moment, the chair said, no one doubts your data, meaning all my visualizations. It's what you did with this data. So thank you for confirming that, and I will tell you later what I have done with this data. But let me first show you what type of data it was. And you can find it directly from the hearing my employers' documents, because they use it against me. They put investigation report, which happened back in 2021. And in here, in red, I put it. Actually, they put it here. You said the percentage of cases, hospitalization, death among vaccinated goes up and up every week. Since the very first report, they put it down. It's too bad. They use it against me that I posted this, and they say it's my opinion. And I say it's not opinion, it's observation. And I will show you today. You will be able to see it yourself. The percentage of COVID deaths among vaccinated goes up and up every week from the time they started reporting. And it's very easy to show. And, and then other things. The half of Canadian provinces had high excess death rate after vaccination has started. So they even put this in writing. So, and they confirm that they don't doubt my data. So essentially they're admitting that what I have written is out of doubt. It's what I have done with this data. So today I'm not going to talk to you about all pieces of evidence which was gathered here and which is used against me as going against the duty of loyalty. And there are graphs here which they posted, which they used snapshots from my website on different graphs, and you will see all of this here. But today I wanted just to record a very simple demonstration of the very first, the simplest fact. It takes 3 minutes to confirm that percentage of COVID cases among vaccinated people goes up every week since Omicron. And for that, we have I have put in the book of documents, in Griever's book of documents here, which are now available all right here. I have volume 2. It's data from PHAC. We'll just open it and we will see it for ourselves. If we do simple Control F search. And I'll have already this document opened in here. It's book of document. It's this volume 2, which has not been used yet. And essentially what it does show, it shows you just, I put together the reports from PHAC, July, October, November, and then at the end, January, February. Just, reports the way they have been published. And you can look at this report, let's say February. This is when I was eventually laid off. I was put on leave without pay because I could not consciously take the second shot, seeing what I have seen in this report. In this very report, when I saw this number, I consciously could not allow this substance to be inserted into my body. Okay, so you see these reports were published, and this was published February the 10th. And you see it has lots of numbers, and you're looking for a very, very simple number. How many people died of COVID being fully vaccinated? Because that's the reason to get vaccinated. You protect yourself, right? So it's a big report, and I wanted my witness, Dr. PHAC, to tell us how difficult it is to find the simple number which will show you the percentage among fully vaccinated who died of COVID. You will not be able to easily find it. Okay, I know what to search for. Look, percentage, you see percentage, I'm typing it, percentage of the. Okay, now percentage, oh, I mistyped it here, percentage of the, because this is the keyword which will allow me easily to go from one report to another. So here, if you type percentage of, and in fact, let's do it from the very first one. The very first one is percentage of the. Look, when you do control search, it will find you. Let's say October as of 30th of. You see, very interesting percentage. So where is my percentage of here? You will see a very interesting thing here. Look, while COVID vaccine are effective, there is still a small percentage of population who are vaccinated and still get infected with COVID-19. So they do confirm that even though you get vaccinated, you do get infected. But they say it's a small percentage. I highlighted a small percentage as of October. But you still would like to know what is small? Like, what is small? Is it like 0.1%? Is it like 1/1,000,000%? Is it 10%? Because that, you need to make a decision for your body, for your life, for your children. Okay, and I know where to look. So the table number 2 is right here. And in October, it says here, fully vaccinated. COVID deaths. Okay, 776. Only 7.8%. And you think, is it small? I don't know. Maybe it's not. Maybe it's small for someone. For me, it's already a big number. But let's see what happens to this number by December or by February, shall we? Okay, we already have percentage of there. We'll just keep searching. Okay, percentage of there. So it's October the 30th. Let's go to the next one. Now, okay, we're on page 114. We're now in December. December 18th, just 2 months. How many? 2 months passed. 3 months passed. And right? So where is my key? So I'm searching here for my percentage of. My percentage of here, small percentage. Remember, small percentage. Go to the next one. Oh, suddenly there is no small. While COVID-19 vaccines are highly effective, a percentage of the population who are vaccinated may become infected and die of COVID. But now they don't say small. Oh, you think, so, I thought that 9% was small. Okay, what is the percentage now? Let's have a look. Okay, the same table 2. Okay, so now it's, it's 10%. Okay, it's slightly more than it was, 7% at that time. So maybe that's already not small. That's already percentage. Okay, you have become curious. Okay, what is the percentage now in January? By the time I had to make the decision. Let's keep searching percentage of. You search percentage of. Okay, which date we are here? January 22nd. Okay, let's see. January 22nd, percentage of. Where is it? Percentage of. Did it say? Okay, small percentage of. And here. Okay, here it is. Percentage of. Which date we are? January 20. Okay, let's see what it is right now. Okay, let's go here. Oh, it's already 20%.
Wow.
It's already 20% of people who are dying. And you said, oh my goodness, just from October to, you see, so I just put it in my writing that the number has been monotonically increasing every week. The beauty is not here yet. I mean, it's not the full beauty here, because they also accuse me of another thing. That, you remember, first I said that vaccinated people die more and more often, monotonically increasing. But secondly, I said something even more drastic in my statement here, where they said that in my documents they used against me this post which I published in here, and it says they said observation number 1. I say observation. I don't make any statements. It's only observation. From the very first report of cases following vaccination published in the end of summer, Public Health Agency of Canada misinformed the public about the observed post-marketing efficacy of COVID vaccines. Instead of 10-20 of fully vaccinated observed weekly among COVID deaths, they have reported only 0.3, because this number which I've shown you in this one, in fact, this is even not the real number. And in the very beginning, when we go back into our first report, which here we have in October, or here actually in July. You see in July, small percentage, very small percentage. And in July, you see it is table 2. Oh, come on, just 85 people. Oh, just 1.2%. Very small, very small. Like they almost don't die of COVID. If you're vaccinated, you don't die of COVID, just 1.2%. But then there is this footnote here. Detailed cases received since December 14, 2020, before vaccines were administered. So these numbers, when they compare people who died of COVID, look, unvaccinated, how many? 6,000 almost. They count since vaccines were approved but not administered. So they were adding cases before they started vaccination. And it's very easy for you to get weekly numbers. You just subtract reports published this week from the numbers published next week. So if you have, let's say, a report, and that's why I put it here. You see in my table of content, I have July, October, and November. So very simple. You go to October number and you go to November number and you subtract those two numbers and you will get exactly the number of people who died of COVID in between those two dates. And then you will see numbers which are way much higher than what they have reported. And this is what is called using data skewing technique, or in computer science language, it's used algorithmic bias. They embed in computing the numbers, because you remember they publish these graphs here, number of cases of people who died of COVID. Look, fully vaccinated, what is it? 1.2%, you see, versus 82%. Wow, this is quite significant. But here, you remember, on top of that, they say somewhere counting from December to 14. So they've added all these numbers, 95% of them more, before they even started vaccinating people. So they embedded algorithmic bias to boost or to show that one population has many more cases than the other population. So I hope this was not too technical and too difficult, but this shows the algorithmic bias which was used by Public Health Agency of Canada to publish these numbers, so that you get these huge numbers for unvaccinated and this small number for fully protected vaccines. So even when I showed you that it goes up, in reality, it goes even much higher when you go on a weekly basis, as opposed to counting cases before they started vaccination. And on the portal here, when in here on my hearing, I have from the very beginning overview. I put it right up front here. This information is available publicly. We built application, web application, which visualizes all this data. It's called Open Canada Vital Statistics Tracker, and it was built with my colleagues during lunch and learns. Sorry. And the beautiful part of the first 3 days of hearing was that I was able to cross-examine my colleagues, my director, and I asked him, do you remember, you were my director, do you remember me presenting this tutorial for all public servants, data engineering, challenges and solutions, demonstration of Shiny? And Shiny is this interactive visualization tool which allows you to visualize multi-dimensional data in a very nice manner. He said, yes, of course I remember. Now, do you remember this paper which you in fact reviewed? Collaborative data science within Government of Canada, development of libraries for common tasks within with Open Canada data and said, yes, I reviewed it. Do you remember it linked to the website where we posted all our applications? And I can search here apps, and it will give you the application. It's the website, it's Open Canada on .github.io, and that was, I think, was the best moment in those 3 days, because this screen was shared with public, and I was told there were many people watching it in live. And this application was added into exhibit, this application. So it shows you the web page where we have been building applications of a lot of potential to show insights which cannot be otherwise easily observed from static PDF files. And one of them, the first one, is right here, Open Canada Vital Statistics. You click on this one, and this was the best moment I had in those days, because we were able to show this app right there at the hearing live. And people would compare then the reports as they're published by Public Health Agency of Canada. Remember, these reports which I've shown you, this is how they look. They publish the numbers, and you want to compare how statistics changes over time. Very simple question. How statistics changes over time? It will be very hard for you unless you do this trick I've shown you. You can search for this percentage over there, and then you will be able to find those numbers. But we were able to show it directly on the web application, right here, and it's live, and you can see it now. Those numbers shown in a beautiful manner. It takes time to load. Actually, I have it. I have it opened on another screen. But once you see it, you see how beautiful it is and how obvious it would be for you to see all the numbers. You're looking for COVID deaths? Go to tab called COVID deaths. You are looking for cases deceased by vaccination status? Go here. So here you go. It shows you COVID cases deceased by vaccination status for each week. And then you can make your own conclusions. How many people died? Or you can look into many other things. Of course, you can look into deaths by causes, death by age, and you will see another red flag, which is excess deaths after vaccination, especially among young Canadians. But this will be kept for the next time. So if anyone has questions, thank you for allowing me to record this, because this is a very, I think, is the easiest piece of evidence which can be shown in 5 minutes to any Canadian who would just would like to see how efficient are vaccines in saving you from COVID deaths. You can look at yourself by going to PHAC data, as I've shown right here, or you can go to the web application, which will show you in a more interactive manner all those things. And by the way, most importantly, the log of all data is right here. So you can open this Google Sheet and you can see yourself all the numbers which have been published every week by Public Health Agency of Canada. Thank you very much.
Dimitri, this is fabulous. I think they picked on the wrong guy.
Who's the wrong guy, Ted?
Dimitri's the wrong guy.
Oh, I thought maybe me or you. Why did he pick on you? He's such a good guy. He's got so much good information that again, the courts will never acknowledge this. Wouldn't it be nice if they would?
Well, what I think Dimitri has effectively done here is that he's not providing any opinion. He's simply providing an easy way to see the data that is available through the Public Health Agency of Canada.